Do your teeth hurt when you brush or you drink something cold or if you eat or drink anything acidic? That sudden jolt of pain is called sensitivity, and in this video I'm going to teach you how to stop it and stop it fast. What are the reasons that it could be happening? What are the DIY tips that you could do at home to take care of it? And when it could mean something serious and you need to visit your dentist right away. Hi folks, I'm Dr. Salman Khan. Welcome back to my YouTube channel, DrBraces. Consider subscribing to my channel if you find my content helpful, because I bring out week on week honest, helpful dental advice only for you guys. So let's dive right into it. So what causes teeth sensitivity? I'll list out the most common causes. Number one is enamel erosion. You see a picture like this, that's where your enamel is eroding over a period of time. This could be due to various things. A lot of acidic beverage intake, a lot of alcohol consumption, or coming next to using hard bristle toothbrush that can lead to abrasions of your enamel. So what happens if you use a hard bristle toothbrush or you brush very vigorously with a lot of force and you brush for a long time, you're brushing more than 5 minutes per session, it could lead to an abrasion in your enamel that exposes your dentine. Next comes your overly eating acidic foods. All the time you're eating pickles, you're eating a lot of lemon, you're exposing your teeth directly to lime soda, beer. A lot of times consumption is too high, your diet is poor. This could lead to acidic erosion of your teeth. Again, that can lead to dentine exposure. When you go and do unscientific teeth whitening, I've had a patient that tried baking soda and lemon at home for teeth whitening. When you do these kind of DIY stuff and when you go and do teeth whitening which is unregulated, which has very high amounts of chemicals that can abrade your enamel, common one is called hydrogen peroxide. When it is used in unscientific quantities, it can lead to erosion of your enamel that could expose your dentine and again cause sensitivity. Apart from this, some of the common ones which we see that go unnoticed is small cavities and small cracks on your teeth. These cracks, sometimes are very difficult to identify. Only a dentist can identify. You will need to visit and get a thorough check done. And these cracks sometimes can, although on the top they look very superficial, but they can actually be very deep, exposing your dentine, and that could lead to you getting these shock-like pains. And finally, you may be doing something called as bruxism or nocturnal grinding, and sometimes you're not even aware of it. If you're married, if you have a partner or spouse, they can tell you whether you're grinding teeth like this, and it could sound something like this, look something like this. Yeah, so when you grind a whole night, when you wake up, you will wake up with high sensitivity. So as you can see in this diagram, when the dentine is exposed, basically what happens, it will have nerve pathways that will send a direct signal to your brain that dentine is exposed and now it needs to give you a reaction of pain. That's how you develop the pain. Now what can you do at home to get relief from this? Number one, use desensitizing toothpaste which contain potassium nitrate, toothpaste like Colgate Sensitive, Sensodyne, and my favorite the Thermoseal Rapid Acting can give you relief immediately. After this, you can avoid consuming acidic foods and beverages for some time. Avoid lime soda, avoid nimbu, avoid pickles, and avoid achar for some time and see if it gives you relief. Stick to lukewarm salt water rinses that will make you more comfortable. And then if you are in the habit of grinding teeth, then get yourself a night guard or a splint and wear it when you go to bed in the night. Most importantly, apply this toothpaste, what I was telling you about, directly on your teeth. Let it sit for some time, and after you've brushed it off, do not rinse your mouth immediately. Let the toothpaste stay, let that fluoride do its work, let that potassium nitrate do its work, let it repair it slowly. If you wash it off vigorously immediately, then there will be no effectiveness remaining. Okay, now let's come to when is it serious and you really need to see a dentist. Let's say you have sensitivity, shocking like pains, it's been 7 days, 10 days, it's not settling, then it's time to go to your dentist. Number two, you have this sensitivity or shocking pain isolated to one particular tooth or one particular region and it keeps coming, it's not at all going, then you need to see your dentist immediately. Number three, your sensitivity is now slowly turning into pain. You cannot enjoy your daily life. when you chew something, when you open your mouth and you try to breathe in air, and then you see that there is even that is becoming painful, then my friend, you need to see the dentist immediately. And let's say you see a visible chip on your tooth or visible cracks on your teeth, which now show exactly the spot where the sensitivity is happening, and you can see that crack or a black spot, then you need to go to your dentist. And finally, if your gums are receding, they are bleeding, and in that same area you're seeing sensitivity any which ways, whether there's sensitivity or not, if you have gums receding and bleeding continuously, then you need to visit your dentist immediately. Now, what are the professional treatments that are available? Normally, we do something called as fluoride varnish. We do a coating of fluoride on top of your tooth which is sensitive. So after we do this, there's a relief immediately. Or we can use bonding agent on the cracks or any areas that are exposed which are very minor. It will seal all the dentine nerves that are exposed, and all this hypersensitivity will get arrested. We also do something called as laser desensitization. That's an in-office procedure for someone who is having general sensitivity suffering from it. And if there are very small cavities, we do something known as spit and fissure sealants. That is, we make some small cavities, get it filled by using this procedure. And finally, if there is sensitivity because of extreme gingival recession, then we will need to do gum grafting. It's a bone graft procedure. We will have to place artificial bone, artificial gum over your receded teeth, and that will cover all the roots which were now exposed to sensitivity, which were now exposed to outer environment that were leading to sensitivity. That after the procedure will start healing, recovering, and slowly you will see sensitivity go down over a period of time. Normally, all of these procedures, nothing's very complicated. There's a routine procedure we keep doing. We keep seeing such patients on a daily basis, and we treat them as a daycare procedure. It's nothing very complicated, but make sure if you have these problems and once you have tried the DIY methods that I've given you at home and it's not working, then you need to visit your dentist immediately. Don't wait out for weeks and months to get. Sometimes I have a patient that I have sensitivity last 6 months. If you're going to wait out for so long, definitely it's going to get more complicated, and you may require more costly treatment which requires more intervention. So finally, tooth sensitivity can come across like a shock, but it's completely manageable. I hope you love this video. If you know of someone who's suffering from sensitivity, do help your friends and family by sharing this video and subscribe to my channel. And I will be back again next week sharing honest dental advice with you. Until then, goodbye.